Hello everyone, my name is Junkai, the product manager responsible for Advantech's iTeleMed solutions. Today I'm very pleased to introduce you how Advantech's iTeleMed solution helps healthcare institutions to establish remote virtual clinic services easily and right away. Currently, many surveys have shown that telemedicine services are beneficial to small primary medical institutions in remote areas, such as health clinics, health centers, and care facilities, and improve the problem of specialist manpower and medical resources that are not easily accessible. Telemedicine services allow residents of remote areas and care facilities to get the necessary medical care nearby, and immediately without the need to travel long distances. However, for the staff of these health clinics and care facilities, they will have some considerations. For example, how do I access patient condition first? How do I transmit patient information to remote doctors in real time and effective manner? How do I collaborate with remote doctors? On the other hand, for large medical centers, providing telemedicine services can also help to break through the geographical limitations and reach more patients, which is more conducive to building a seamless, efficient, and patient care delivery and transition system from the community. But for these medical centers, they also need a convenient platform that allows their doctors to arrange the schedule of remote outpatient clinics, manage records of remote consultations for patients, and even hope to integrate the process of remote virtual outpatient clinics into existing hospital processes. In order to solve the problems as I mentioned, Advantech has launched the iTeleMed software solution, hoping to help healthcare institutions establish telemedicine care services easily and quickly. Advantech's iTeleMed solution has 4 major features. The first one is lightweight design. The iTeleMed software's architecture is simple and does not require sophisticated hardware or server host. The second one is easy deployment. iTeleMed can support private cloud deployment and it can also be deployed on public cloud according to the requirement. It is web-based and doesn't need to install additional applications. The third one is intuitive operation. iTeleMed adopts intuitive design from appointment, registration to medical records, which largely lowers the learning barrier for users. Finally, iTeleMed complies with the HIPAA Medical Information Security Regulations, which further guarantees the security and privacy of patient data transmission. The system architecture of iTeleMed can be simply divided into 3 parts. The first one is the iTeleMed server, which directly connects primary medical institutions, nursing facilities, and the large medical centers together. Collaboration and data synchronization from both ends can be done on iTeleMed, such as scheduling for virtual consulting hours, medical records, virtual queue dashboard. The second part is, through a client application, iExam, the examination result files generated by external medical devices such as digital exam camera, electrocardiograph, or ultrasound can be directly uploaded to the iTeleMed server automatically, so that remote doctors can review the examination result in real time. This achieves the core concept of telemedicine, which is operate examination in one place and interpret the result in another place. The third part is the video conferencing platform. In addition to Advantech's partner, VC or Octan's video conferencing software, iTeleMed is compatible with the common third-party video conferencing platforms in the market. In addition, we have also selected hardware solutions that are suitable for the use with iTeleMed. For example, the Telehealth card can be used as a workstation in a limited space, and the Telehealth Suitcase can be used for roving medical services and emergency care in ambulances. The Telehealth desktop station is suitable for setting in the consultation room or office table. Besides, we also provide a variety of medical devices such as digital exam camera electronic stethoscope, portable 12-lead electrocardiograph, and wireless handheld ultrasound. Now, let me continue to introduce the workflow of iTeleMed and then the main user interface. Basically, the process of a remote virtual clinic is roughly the same as that of physical clinic. Therefore, the process on iTeleMed starts from scheduling consulting hours by doctors in the medical center and then making appointments and the registration for patients by staff in the primary medical institution. Also, the staff performs a preliminary examination for the patient and transmits the examination results to the doctors in real time. At the same time, the doctor can consult the patient through video chat, review the examination results, and write the medical record. After completing the consultation of the current patient, the doctor can invite the next patient to come in through the queue dashboard. Finally, the examination results and the medical records will be compiled into a report, which will be saved according to the patient and the time of the consultation for future review. These data can also be sent back to hospitals' existing information system through API, which can avoid the inconvenience of repeated data entry. So, open a web browser and log into iTeleMed page. If you are a doctor in a medical center, please select Doctor Mode. If you are staff in a primary medical institution, such as a rural health clinic, please select Service Mode. After logging in, users will see the virtual clinic hours first. iTeleMed allows doctors to schedule their own virtual clinic hours for accepting appointments, which will be automatically synchronized to the calendar of the primary medical institution, reducing the inconvenience of manual notification. And each virtual clinic hours can be also synchronized to the user's own Google Calendar or Outlook calendar. The step for doctors to schedule virtual clinic hours is also quite simple. Just need to fill in the necessary information such as date, time, which institution to provide the consultation service to, and the link of the video conference. In addition to Advantech's partner, VC or Octane, users can also fill in the meeting link of any third-party video conference platform according to their preference. Once the doctor has scheduled virtual clinic hours, the staff of the primary institution can start making appointments, registration, and performing preliminary examinations for patients. The list of the registered patients will be automatically synchronized to the doctor's page, so that the doctor can keep updated of the number of the patients, the basic information of the patients, and the examination results at any time before starting the consultation. It is also very simple for the staff of the primary institution to perform the examination for the patients. Launch the iExam client application with one click on the iTeleMed page. The basic information of the patient to be examined will be automatically imported. Then select the medical device and start examination. The result will be automatically uploaded to the iTeleMed database. iExam is an open application for uploading the examination result on any brand of medical devices to iTeleMed, as long as the setting of file storage is complied. The examination results uploaded to iTeleMed will be classified and displayed according to the patient and the device type, and the users can review the results by date and time. Once everything is ready, the doctors can start video chat for patient consultation through VC Messenger or any other third-party video conferencing platform. During the consultation, the doctors can see the list of waiting patients, the waiting time of each patient. Also, the doctors can write the SOAP medical record of patients and attach significant examination results uploaded by iExam to the medical record. In addition, the data in the medical records can be automatically sent back to the hospital's information system, which can avoid the inconvenience of repeated data entry. On the other hand, patients who are waiting for video consultation can check the progress of doctor's consultation through the virtual queue dashboard. Finally, after the video consultation is completed, a complete medical record report will be saved for each patient, which is convenient for the doctors and the staff of the primary institution to review or explore the medical record. After introducing the workflow and the user interface of iTeleMed, I will continue to elaborate 3 application scenarios for you to understand how healthcare institutions can establish cross-institution telemedicine services through iTeleMed solution. The first one and the most common application scenario is the virtual outpatient service of primary medical institution in remote areas. Health centers or nursing facilities in remote areas can collaborate with large medical centers through the functions of iTeleMed, such as clinic hour schedule, appointment, registration, patient examination, and medical records. It allows hospital doctors to easily set up remote virtual clinics without having to visit this remote institution in person. And the residents in these areas can access medical services without traveling long distances, which saves the cost for both the doctors and the patients. The second one is HealthSpot at chain pharmacies. This is an on-demand, non-emergent medical services provided through the cooperation between chain pharmacies and the medical centers, such as for chronic patients who need to ask a doctor to prescribe medication. The HealthSpot is usually set up in a room in the pharmacy where there will be a video conferencing system and a simple medical devices. The remote doctor will consult the patient through video chat and guide the patient to operate the medical devices for examination, then give diagnostic suggestions and issue prescriptions, so that a pharmacist can provide the medicine to the patients according to the doctor's prescription. The third application is remote emergency care support on the offshore vessels. For workers who need to stay on vessels for a long period, such as members on the offshore wind farm or the offshore oil platform, it is not easy for them to obtain professional medical care immediately due to the limitation environment and cost. Through iTeleMed, the staff on board can collaborate with the emergency doctors of the hospital in real time. The doctors can remotely guide the staff to give first-line treatment and determine whether to transfer the patients to the nearest hospital by vessel docking or helicopter transport. Even during the transfer, the doctor can still continuously monitor the patient's condition. According to the different application scenarios, there are different hardware solutions that are suitable for the use with iTeleMed. The first one is MS30EP Slim Telehealth Workstation, which is lightweight design and suitable for environment with limited space. The dual screen design allows medical staff to operate iTeleMed and the patients to focus on video consultation with doctors at the same time. The second one is MS72 Powered Telehealth Workstation, which is a video consultation cart with its own power system and electric height adjustment and is suitable for mobile applications. For example, the staff in nursing facility can move the cart in different rooms to provide video consultation for residents who are unable to walk around. The third one is the MS22 Telehealth Suitcase. In addition to a tablet computer for operating iTeleMed, the 20-inch Suitcase is designed to accommodate a variety of medical devices. It is suitable for extreme and space-limited environments, such as mobile clinics, roving medical services for in-home visits, vessels, ambulances, and even military frontline. That's all for the introduction of Advantech's iTeleMed solution for virtual clinics. Thanks for watching. See you next time.